Good morning, class. My name is Jesus, and I will be focusing on local advanced practice nursing programs, starting with our very own San Jose State's master's program. Now, this master's program focuses on specialty areas in nurse educating and family nurse practitioners. The nurse educators, you can see, is a 36-unit program, and the family nurse practitioner is a 42-unit program. Now, each program is about a 5-semester long duration, with both programs being hybrid format. Now, attendance is required once a week, usually on a Tuesday or Wednesday, with an additional 1 to 3 days for clinicals. Now, for the SHU's Nurse Educator program, this is the rundown of the classes you will be taking, ranging anywhere from healthcare systems to advanced pathophysiology and advanced pharmacology. We can't get rid of those. As well as some curriculum design, as well as nurse education theories, and a master's project during semester 4 and 5. Now, for the family nurse practitioner program, you're still going to have the pharmacology and pathophysiology, except you're just going to have more practicums, aka clinicals, starting from semester 3 all the way to your 5th semester. You're also going to have a lot more theory classes as opposed to the nurse educator. Now, how do you apply, you may say? Well, applications are accepted October 1st through March 1st in order to begin that following fall. You apply through Cal State Apply with the $55 fee. I know everyone's kind of concerned about money, so I'm adding it in here. You're also going to need a personal statement with questions such as, what are your goals and passions? Why are you applying to the FNP or nurse educating program? What are you bringing to the program? You're also going to need 2 letters of recommendation, your current unrestricted California license with a current resume, and apparently you also need a short video describing your nursing experience. Requirements needed to apply is a bachelor's in nursing or a bachelor's in another field with an associate's in nursing. You need 2 years of RN experience for an FNP and 1 or 2 years of experience for a nurse educator. You also need to hold a 3.0 GPA within the last 60 units of your undergraduate coursework. Now, the program fees for these 2 programs is as follows. For the family nurse practitioner program cost, you pay your graduate studies application, that's the $55 I talked about earlier, your program fee of $250, which no one really knows where it goes, your Castle branch fee, your lab fees, your tuition, totaling up to $46,000 for your FNP. For your nurse educators, about half of that, totaling at $22,000. SHU also has a doctor's in nursing practice program, with the majority of the program being held online, with the exception of a one-time on-campus meeting at the beginning of each semester. Now, each student starts in the fall, meaning there's only 1 cohort class per year. The semester lasts around 5 semesters, with a total of about 23 hours, consists of 3 courses per semester, and the clinical hours that you actually accrued during your master's work are applicable towards the 1,000 post-bachelorate practicum hours required for the program. The MP program at SHU is designed to mesh with the full-time professional work schedule, meaning for those of you that were scared of having to drop part-time in order to pursue higher education, this DNP program allows you to maintain full-time while you get that advanced education. Now, the requirements needed for this is an active unrestricted California RN license or an advanced practice national certification. You also need your master's degree in nursing science with a GPA of 3.0 or above in the pre-doctoral courses. You also need a personal written statement of purpose. Now, the tuition for this program, as I saw, was roughly around $7,600 per semester. Now, since it is about 5 semesters long, this ends up totaling up to $38,000 for this program. Other local advanced practice nursing options are the University of San Francisco. Now, they have a Master's of Science in Nursing with pathways such as an associate's to a master's degree, which is a 46-unit, 6-semester program, or a BSN to MSN program that is 35 units and roughly still 6 semesters. Now the class options are hybrid classes, which are held once a week on the Pleasanton campus, plus online modules. Now you also have the option of going 100% online. You need 400 practicum hours, and students are responsible for securing their site actually. Now the cost for this is around $1,400 per unit, so if you do the multiplication, you'll get your total cost for the program. CSU East-based hybrid MSN program focuses on the specialties of nursing education and nurse leadership and administration. This is a 33-unit program that lasts about 4 semesters. Now students must maintain a 3.0 GPA or above. Another local APN option is Family Merits program. Now they have a master's for family nurse practitioning, which is fully online, 49 units, and can be completed in as little as 20 months and roughly costs around $76,000. They also have a nurse anesthesia program, which is a 66-unit course, 2.5 years to complete, and costs around $107,000. And they also have a doctor's of nursing practice that is also fully online. It's a 2-year full-time or 4-year part-time program that costs roughly around $48K. Now, the careers that you could work under as a DNP would be such as Chief of Nursing Officer, Director of Nursing, Nurse Administrator, or even a nurse researcher. Now, people may ask, what's the difference between a PhD and a DNP? Well, research or application is PhD, where they typically are rooted in academic and clinical research and prepare students to work in nursing education. As to a DNP, however, they tend to focus more on the clinical practice of nursing, more inpatient-wise. If you feel like going a little further down south in California, you have UCLA, which has a nurse practitioner specialties in pediatrics, adult gerontology, and family nurse practitioning, and they also have a DNP program. A little further down is San Diego State, which has an advanced practice nursing of adults and elderly nurse practitioner program, as well as nurse leadership and healthcare systems. CSU San Marcos lies somewhere in between those UCLA and San Diego State. They have a clinical nurse specialist, family nurse practitioner, FNP, and a psychiatric mental health nurse practitioner. A little bit down south is CSU Dominguez Hills. They have a family nurse practitioner program, a clinical nurse specialist, a nurse administrator, and a nurse educator program. I was looking into CSU Fresno, but don't apply there because they lost their accreditation in the fall of 2018, which leads me to an important point. Make sure you research your schools to make sure that they have their accreditation currently. Now to talk about advanced practice nurses leading change. But first, we must identify what a leader is. A leader is a person who embodies and uses these abilities and skills to create a vision and engage others to share that vision. Leaders are thought to be mainly in administrative or management roles, while advanced practice nurses, such as nurse practitioners, are defined as informal or just clinical leaders. What a lot of people don't realize is that advanced practice nurses are frontline healthcare providers and therefore are not recognized as formal leaders. They spend most of their time providing direct patient care. In a clinical study done in Canada aimed at exploring advanced practice nurses' perceptions of their leadership capabilities, 2 main themes were identified: patient-focused leadership and organization and system-focused leadership. These themes articulated the APN's contribution to improving the care environment for patients and families, nurses and other healthcare providers, and organizations and the healthcare system. In the Campaign for Action website, 10 nurses were recognized with the Breakthrough Leaders in Nursing Award, created by the Future of Nursing Campaign for Action. These 10 leaders made an impact on the community and healthcare system. The award recipients worked to help medically fragile children, neurologically impaired individuals, and low-income women in rural areas. They have also helped improve the quality of medical care in Vermont, protect healthcare workers from exposure to carcinogens in North Carolina, prevent bed sores and reduce Medicaid costs in Texas, and recruit and encourage minority nursing students in Wisconsin. These leaders hold degrees anywhere from Masters of Public Health, Doctors of Nurse Practice, Women in Health, and Psychiatric Mental Health Nurse Practitioners, as well as PhDs. These outstanding leaders represent the future of nursing and the ability to make change towards a better future in the healthcare system. For reasons as to why advanced practice nurses are valuable. For one, they are more affordable to the healthcare system than a physician. The Human Resources for Health conducted a systemic review on the impact of the advanced practice nursing role on quality of care, clinical outcomes, patient satisfaction, and cost in the emergency and critical care settings. They discovered that the involvement of nurses in advanced practice in emergency and critical care improves the length of stay, time to consultation and treatment, mortality, patient satisfaction, and cost savings, all of which are huge goals for a facility to attain. To conclude and point out the most important, advanced practice nurses are the front line of work. In other words, nurses dedicate a lot of their time on direct patient care, which is a valuable aspect to the overall holistic approach and the importance of patient-centered care in our health field.